Good day everyone. I am Deepti Chavan, an MDR TB survivor, advocate and fellow with SATB. It gives me immense pleasure to be speaking at the plenary session for India TB Summit. Before COVID-19 arrived and devastated us, TB was India's severest health crisis. Even today, TB kills 1200 Indians every day, and yet it is discussed in hushed tones. TB affected persons are stigmatized and discriminated against and are often forced to suffer in silence. The COVID-19 pandemic has changed the way the world lives. It has devastated TB affected persons and communities. Access, affordability and availability of care were all significantly compromised. TB affected communities still struggle every day. Yet see the contrast. A disease that primarily started by affecting the rich, that is COVID-19, saw billions in investment. TB has been with us for centuries, and very little was done in terms of investment and research in TB, even lesser so when compared to the amount of money that was spent on fighting COVID-19. Even today, we have one vaccine, that too 100 years old. Imagine if this injustice were happening to powerful communities. We would have seen it as a violation of their rights. Yet, very little is spoken about patients and their rights. Ever wondered why? We need to understand that patients are not subjects or statistics, but living, breathing people. It is their right and our ethical duty to explain their condition and not dismiss their concerns. It is not just the need of the hour, but our ethical duty to redesign the TB care patients are currently receiving. This care needs to be equitable and accessible, ensuring the highest quality to all patients. The TB care continuum needs to be transparent, taking community inputs at each stage of development and implementation. You cannot bring communities as a token gesture. They ought to have a seat at the table and be substantially involved. Otherwise, all efforts are bound to fail. This engagement has to be diverse, including in its fold TB survivors, but also communities of people living with HIV and marginalized communities such as the LGBTQIA that often do not get access to high quality care. Survivors and patients need to be made equal stakeholders in policies and decisions in TB care by the government and by their health providers. You cannot make decisions for us. We have a point of view and we have a voice. An engaged and informed community is a community empowered to engage in beneficial care-seeking behavior. Investment and ownership in the drug development process is what would allow for better treatment outcomes and successful prevention initiatives. We need to make diagnosis, treatment more affordable and accessible for patients. We need new and more flexible forms of service delivery along with remote support. We also need better economic support programs for TB patients. The current Nikshay Poshan Yojana is not enough. The mental health cost of TB can be very high, and integrating mental health care in TB care is critical. This can be done by creating expanded mental health services and training healthcare staff and TB helpline workers in counseling, etc. To ensure that discrimination against TB patients and survivors is tackled, we need legal punitive action against discrimination. Please train healthcare staff to avoid class, caste and gender-based discrimination. As a survivor and a fellow with SATB, I can tell you that peer and mentor support networks, as well as patient education groups, help patients adhere to treatment. The patient is the most important stakeholder in this fight. Fight the disease, not the person infected by it. Let us reimagine patient care by putting the person at the center of the care model and not the disease. Nothing about us without us. Thank you.